Hi, good morning. My name is Ivan Clarence Mindaros, your student nurse for today. And for today's video, I'm going to perform assessing the abdomen. First is to review the client's medical record if available. Next is to prepare the necessary equipment that we needed. Equipment that we needed is stethoscope, a tape measure, and a sharp object, like this ruler. Next is to perform hand washing to avoid the spread of organisms. So, good morning, ma'am. My name is Ivan Clarence Mindaros, your student nurse for the day. May I know your complete name and address, ma'am?
I am Florami Mindaros. I live in Umaoa Street, Digos City.
And how would you like me to call you, ma'am?
Flora.
Okay. So, for today, ma'am, I will assessing your abdomen. So, I will expose your abdomen and listen for your vowel sounds and feel your internal organs. Is that be alright to you, ma'am?
Yes.
Okay. Do I mind if I close the door and curtains, ma'am, so no one can disturb us during the procedure?
Yes.
Okay. Ensure the patient to empty his bladder prior to conduct the assessment. So, for the inspection, position the client in a supine position with arms folded over the chest or at the sides. Place a pillow underneath the client's knees to slightly flex the knees. Cover the upper and lower body parts of head with a bed sheet, leaving the abdomen exposed from xiphoid process to just above the symphysis pubis. Confirm the abdominal pain location if present. Do you feel any pain in your abdomen, ma'am?
No.
For the abdominal skin characteristics, assess for the abdominal skin temperature, color, scars, stray, vascularitis, rashes, ecchymosis, and other lesion. Note for its characteristics, which is size, shape, color, texture, location, and presence of discharge. For umbilicus, bulges, and mass, observe for umbilical location, color, and contour, including presence of mass or bulges, suggesting of ventral hernia. Emphasize for any bulging or mass by having the client flex his head. For the abdominal contour and symmetry, contour while the client lies flat supine on the bed. Sit beside the client, look across the abdomen at a level slightly higher than the client's abdomen. Okay. For symmetry, while standing at the foot of the bed, observe the abdominal symmetry while client is in a relaxed position. Okay. Measure the abdominal girth. Measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. I will measure your abdomen, ma'am.
Yes.
Now observe for abdominal movements. Observe the abdominal respiratory movements, aortic pulsation, and peristalsis. Okay. Now proceeding for the auscultation of bowel sounds, ask the client's last intake and warm hands and diaphragm of the stethoscope. When did you last eat, ma'am?
Last night.
Okay. Auscultate each of the four abdominal using the diaphragm for at least 1 minute, beginning at the right lower quadrant, proceeding in a clockwise direction, noting for intensity, pitch, intensity, pitch, and frequency of vowel sounds. Use light pressure when auscultating painful or tender areas. Now for the vascular sounds, use the bell of the stethoscope to listen for bruit at over the abdominal aorta and renal, iliac, and femoral arteries, venous hum in the epigastric and umbilical areas. Now for the peritoneal friction rub, use the diaphragm of the stethoscope to listen for friction rub over the liver and spleen. Now for percussion, for the abdominal tone, percuss several areas in each at the four quadrants to determine presence of tympani and dullness following a systematic pattern. Now for the vertical lever at the mid-clavicular line, for lower border or liver dullness, starting for the right lower quadrant along the mid-clavicular line, percuss upward toward the liver. Note the change for the from tympani to dullness and mark this point. Mark your domain mo. Now for the upper border of dullness or liver dullness, begin percussion on the right mid-clavicular line at an area of lung resonance around the third intercostal space. Continue downward until the percussion tone changes to from resonance to liver dullness and mark this point. Now measure the distance between the 2 points. Now for vertical liver span at the mid-sternal line, for lower border of liver dullness, starting just above the umbilicus, percuss upward toward the liver along the mid-sternal line. Note the change from tympani to dullness and mark this point. For the upper border of liver dullness, begin percussion at the body of the sternum along the third intercostal space and continue downward until the percussion tone changes from flat to liver dullness and mark this point. Now measure the distance of these 2 points. Now for the liver descent, ask the client to take a deep breath and hold it while percussing from the right lower quadrant along the mid-clavicular line toward the liver. Note the change from the tympani to liver dullness and mark this point. Ask the client to exhale, measure the distance of point lower border liver dullness during deep inhalation from the right costal margin along the mid-clavicular line. Okay, now, ma'am, I need you to take a deep breath. Take a deep breath, ma'am, and hold it. Now you can exhale now, ma'am. And measure the Now for the spleen, reposition the patient to the right side lying position with left knee flex and identify the left anterior axillary line. To assess the size of the spleen, percuss the left anterior chest wall roughly from the border of the cardiac dullness at the 6th rib to anterior axillary line and down to the costal margin and percuss for tympani and dullness. Check for the splenic percussion sign. Percuss the lowest interspace in the left anterior axillary line, then ask the client to take a deep breath. Please take a deep breath, ma'am. Now for the liver blunt percussion. While client is lying supine, percuss the liver by placing the left hand flat against the lower right anterior rib cage. Use the ulnar side of the right fist to strike the left left hand and ask for any pain. Do you feel any pain, ma'am?
No.
Okay. Now for the kidney punch, reposition the patient to sitting position and place left hand at the cos- costovertebral angle over the 12 rib. Use the ulnar side at the right fist to strike the left hand and ask for any pain. Do you feel any pain, ma'am?
No.
Here, ma'am.
No.
Do you feel any pain,
No.
ma'am? Here?
No.
Here.
No.
Okay. Now test for the ascites. Test for shifting dullness. While client is in a supine position, percuss the flanks from the bed upward toward the umbilicus, noting the change from dullness to tympani and mark this point. For reposition the patient to side lying position and percuss the flanks from the bed lying position, percuss the abdomen from bed upward, noting the change from dullness to tympani. I need to roll over at your side, ma'am. Okay. Now for the fluid wave test. While client is in a supine position, ask the client or an assistant to press the edges of both hands firmly down the midline of the abdomen. Tap one flank sharply with fingertips. Feel for fluid wave transmitted across the abdomen to opposite flank. Okay, ma'am, I need you to put your hand in your... Okay, thank you, ma'am. Now for the light palpation, will client relax in a supine position? Begin with a light, systematic palpation of all 4 quadrants or 9 regions using the finger pads initially, avoiding any areas that the patient had identified as painful. Observe for reports of pain, guarding, tenderness, and behavior and masses. Now for the deep palpation, compress the abdomen to maximum depth 5 to 6 cm using the palmar surface of the hands, initially avoiding the painful areas and palpated for muscle resistance or masses. Now for the umbilicus and surrounding area, perform moderate palpation at the umbilical ring, noting for any presence of masses, swelling, nodules, and granulation. Now for the abdominal aorta. Use thumb and index finger and use both hands to deeply palpate the epigastrium slightly to the left midline of presence of abdominal aortic pulsation. Now for the palpation of the liver. Place the left hand under the client's back at the left of 11 to 12 and ribs while the right hand is laid parallel to the right costal margin with fingertips pointing towards the client's head, and instruct the client to take a deep breath, then compress the fingertips upward and inward to the lower border of the liver and assess for contour, surface, presence of nodules, tenderness, and irregularity. Take a deep breath, ma'am. Now for palpate the liver by hooking technique or alternative technique. Stand the client to the right side facing his or her feet. Press in and up toward the costal margin with your fingers and ask the patient to take a deep breath and gently firmly pull inward and upward with the fingers. Palpate for the liver edges at the descent to meet the fingers, noting for contour, surface, presence of nodules, tenderness, and irregularity. Take a deep breath, ma'am. Okay. Now for the spleen, stand at the client's right side, reach over the abdomen with left hand under the posterior lower ribs and pulled up gently. Place the right hand below the left costal margin and press inward to the spleen. Ask the client to take a deep breath, then press inward and upwarding using the right hand as the left provided support. Being palpation below the costal margin and try to feel the tip or edge of the spleen as it comes down to meet fingertips. Note for any tenderness and assess the splenic contour. Take a deep breath, ma'am. Again. Okay. Repeat the procedure with the client lying on the right side with legs somewhat flexed on the hips and knees as needed. Now I need you to turn in your right, ma'am. Right side, ma'am. Okay. Take a deep breath, ma'am. Again, ma'am. Okay, thank you. Now for the kidneys, stand at the patient's right side. Place the left hand under the patient's right posterior flank and the right hand at the right costal margin at the mid-clavicular line. Instruct the client to take a deep breath, then compress the finger during peak inspiration. Ask the client to exhale and hold this breath briefly and gradually release the pressure of right hand to feel the right kidney slipping beneath the right fingers. Now I need you to take a deep breath, ma'am, and hold it. Again, ma'am. Hold it. Okay. Palpate the left kidney with the procedure reverse. Take a deep breath, ma'am. And hold it. Again, ma'am. Hold it. Okay, thank you. Now for the urinary bladder, begin palpating at the symphysis pubis and move upward and outward to estimate the bladder borders. Now test for the appendicitis or the peritoneal irritation, rebound tenderness. Palpate deeply at 90 degrees into the abdomen, halfway between the umbilicus and the anterior iliac crest. Then suddenly release pressure. Listen and watch for client's expression of pain. Ask the client to describe which hurt more, the pressing in or the releasing, and where on the abdomen the pain occurred. Okay, ma'am. Do you feel any pain when I'm pressing your abdomen?
No.
Do you feel any pain when I'm releasing your abdomen, ma'am?
No.
Okay, thank you. Now for referred rebound tenderness or the Robsing signs, palpate deeply in a lower left quadrant, quickly release pressure and assess for pain location. Okay, ma'am, do you feel any pain when I'm pressing your abdomen?
No.
Do you feel any pain when you're releasing your abdomen?
No.
Okay, thank you. Now test for the SOA signs. Support the client's right knee and ankle and flex the hip. Now test for the SOA sign. Reposition to left side lying position and hyperextend the client's right leg. So ma'am, I need you to the left side. Okay. Do you feel any pain, ma'am?
No.
Here, ma'am.
No.
Okay, thank you. Now test for the obturator sign. Support the client's right knee, ankle, and flex the hip and knee and rotate the leg internally and externally. Do you feel any pain, ma'am?
No.
Do you feel any pain?
No.
Okay. Now for the hypersensitivity test. Position the client supine with the knee slightly flexed, support by a pillow. Underneath, stroke the abdomen with a sharp object or broken cotton, trip applicator or tongue blade, or grasp the fold of the skin with your thumb and index finger and quickly let go. Do this several times along the abdominal wall. Note for complaints of pain and exaggerated sensation. Do you feel any pain, ma'am?
No.
Do you feel any pain?
No.
Okay. Now for test for Murphy's sign or test for cholecystitis, press your fingertips under the liver border at the right costal margin and ask the client to inhale deeply. Note for increase in pain felt. Inhale deeply, ma'am. Do you feel any pain, ma'am?
No.
Again. Okay, thank you. Now we're done with the assessment, ma'am, of your abdomen. Here is the summary of what we have just done upon inspection. Your skin is uniform in color. No rashes, no lesions, no your umbilicus or your navel is in midline and inverted, which is normal. Your abdomen is symmetrical and upon auscultation of your bowel sounds, while I was listening to your abdomen, the sounds are pretty normal. In the hair, no brewy or sound, venous hum, while I was measuring for your liver size on your liver span at the right liver mid-clavicular line here. I measured this at 7 centimeters, and while I was measuring for your liver span at the mid-sternal line, it is measured at 5 centimeters, which falls within the normal range. Okay? So upon percussion and palpation, there were no tenderness and no masses, no bulges and no swelling. Overall, your abdomen is normal, ma'am, or good. Okay? Do you have any questions or clarifications, ma'am?
No.
So overall, your abdomen is good, ma'am. So thank you for your cooperation, ma'am.